everybody. Welcome to our webinar this evening called Life's. This is our webinar on supporting your hormone health through lifestyle medicine. This is Allara Health. If you didn't know that already, if you haven't already, come to join and meet some of our wonderful medical providers and registered dietitians here at Allara and our community members. This talk tonight is part of your experience as an Allara patient, or if this is like the first time that you're seeing anything about Allara, we are really excited to have you here and have a chance for you to hear a little bit more about one of the key aspects of our practice, which is lifestyle medicine. So again, the title of this webinar, if you were still joining, is Supporting Your Hormone Health Through Lifestyle Medicine. Our two experts who will be speaking tonight are Dr. Hardacre and Dr. Pimputkar. They are both practitioners on the Allara platform, so you might even see one of these practitioners in your visit if you decide that you are having an appointment with us. I'm going to introduce both of our esteemed doctors this evening and have them do like just a quick intro about themselves and what really drew them to want to be part of the Allara platform. Okay, and then we're going to get into some really juicy topics about lifestyle medicine, and then we will have some questions. Thank you for everybody who did submit questions for this webinar this evening. We'll get to some really good questions that are submitted by you all. All right, so I'm going to start with Dr. Hardacre. Please give us a little bit of an intro about yourself and why did you want to come join Allara Health?
Sure. Yeah, like Danielle said, I'm Dr. Hardacre. I am a board certified OBGYN. I'm also board certified in lifestyle medicine as well as obesity medicine. I have practiced for 23 and a half years, which just seems absolutely crazy. I don't feel that old, but I guess, yeah, that time doesn't lie. Anyway, and, I came to Allara because I really enjoyed working with the PCOS diagnosis. I already had at that time, I was already practicing a lot of lifestyle medicine. I felt that PCOS was just one of those diagnoses where there was just such a beautiful connection between medical and lifestyle management. And when I found Allara, and that's what Allara specializes in, I just was really drawn in. And yeah, so I've been here for over a year.
Okay, all righty. Thank you so much. What a fantastic bio. Okay, Dr. Pimputkar, please, if you can introduce yourself, let me know if you need me to unmute you. You can introduce yourself and give us a little bit of a reason why you decided to join Allara.
All right. Well, thank you so much for having me. And I am so excited to be here. My story is similar to Dr. Hardacre's. I've been practicing as a board certified OBGYN for almost 20 years. And in the traditional clinical setting, seeing patients, doing the procedures, doing the deliveries, just providing routine gynecologic and obstetric care. And as I evolved with my practice, I realized that the one place that I was very drawn to and also felt professionally that I couldn't accomplish everything that I wanted to was specifically talking to patients who struggled with chronic hormonal conditions, PCOS, thyroid conditions, premenopause, menopausal conditions, all of the above. And in the traditional healthcare setting, I didn't always have enough time to really address what was going on. And I always felt like I was not getting a chance to do what I love to do, which was practice lifestyle medicine in conjunction with traditional medicine. So along the ways, I discovered lifestyle medicine, I became board certified, and then I felt like the stars aligned and I found Allara, and this was just it was a calling that I had to do. So I left the traditional clinical setting and now I'm practicing here, and it gives me the opportunity to merge the two concepts and fields of medicine that I really enjoy practicing.
It's amazing. We are extremely fortunate to have both of you, just with your wealth of knowledge, and not only that, but your just the heart and soul that you bring to this practice, in the way that you are so empathetic towards patients, and you look at things from such a 360 view. And it's not just your average neighborhood OBGYN that has a couple of suggestions, but you really kind of take this whole person approach. So we're going to get into that now, which is lifestyle medicine. And let me start by letting Dr. Hardacre tell us, what is lifestyle medicine?
Yeah, I first of all like to point out that when we're practicing lifestyle medicine, and I think this is a really important thing to understand about it, that it is it's evidence-based medicine. So this is based all on scientific studies that have been done on diagnoses and 6 pillars that are kind of known as like the 6 pillars of healthy lifestyle. Those 6 pillars are nutrition, physical activity, stress management, sleep optimization, social connection, and avoiding toxins such as tobacco, alcohol, drugs, etc. And so the goal is to use those 6 pillars in this evidence-based way to help prevent or reverse or manage lifestyle-related chronic diseases. So like when we think of those diseases, it can be management of a hypertension diagnosis, of an obesity diagnosis, of pre-diabetes or insulin resistance, or diabetes or metabolic syndrome or cardiovascular disease. These are all things that can really be managed beautifully with lifestyle medicine. And so, yeah, that's kind of summarizes it, I think.
Yeah, absolutely. It definitely does. Great summary. So there are, when we're talking about kind of the prevention of and reversal of chronic diseases, like some of the things we treat on our platform, Hashimoto's, thyroid diseases, prediabetes, diabetes, metabolic syndrome. What do we use lifestyle medicine for as far as like prevention and reversal?
I think like if I were to separate it from just like a normal physician or provider encounter, where maybe you got some lifestyle suggestions. Very frequently I'll hear people say, "Oh, I was told to exercise more, or I was told to lose some weight," but I think lifestyle medicine really is looking at like, okay, how do you make really sustainable, meaningful changes?
Right. So different than
accomplish that.
So different than your, exercise and lose weight kind of thing that a lot of people have gotten from past practitioners.
Right.
Yeah. So we're really talking more about like meaningful and sustainable advancements.
Right. And it's like helping the patient, like really identify like what their health goals are, and recognizing everybody's coming from a different place in their life. And so, where a starting point for one person is going to be different than a starting point for another person. And so taking the time and having those conversations of what is their starting point, what really are their goals, how can we make changes that fit within their life, because that's what then makes it sustainable, is if they find things that they can actually do with their lifestyle. So it goes much deeper than those kind of quick, lifestyle recommendations of just eat better or something.
Yes. And for everybody here, as a viewer, we're going to get into some more kind of concrete examples of how to do this in a little while. So bear with us while we get to that part. So Dr. Pimputkar, I'm going to kick it over to you here to tell us a little bit about the like kind of again how we sort of incorporate this lifestyle medicine into an overall plan for our patients here at Allara. So at Allara, we have a place for traditional Western medicine, and many of our doctors do come from a background of traditional Western medicine, just like both of you. And then we also incorporate lifestyle medicine. So tell us a little bit about what the goal is for using this approach. So tell us a little bit about that and how this kind of complements both practices kind of complement one another.
So I think to definitely piggyback off of what Dr. Hardacre said earlier is, we have in traditional healthcare, again, for all different reasons. Sometimes it's the constraint of time. Sometimes it is, just the way that we are in the system of medicine now. We give these general blanketed pieces of advice without really any direction. And what lifestyle medicine does is it just simply pauses. It takes the time to ask a patient, like, how did you get there? How did this happen? Like, what were the circumstances that led you to end up in a place where you're suffering from the chronic hormonal disturbances or the metabolic changes, or not putting blame or judgment on any one part of the equation, but really understanding kind of the root cause as to what happened, and then moving forward, coming up with like actionable strategies, like Dr. Hardacre had, mentioned. It doesn't make sense for us to give advice that is just unattainable. Then we're never going to be able to set our patients up for success. So I like to reference. There is, Dr. Peter Attia, who is kind of a longevity medicine expert. And he recently wrote a book, and, it's like on Oprah's, bestseller list right now. It's called Outlive the Art and Science of Longevity Medicine. And I think he breaks it down very eloquently. He talks about medicine 2.0 versus medicine 3.0. So medicine 2.0 clearly has a place because we have made major advances in science. We have vaccines for infections. We have, advanced surgical techniques for cancer treatments. And obviously medicine 2.0 we could not be where we are today without what medicine 2.0 has brought to the table. But over time, it has become like a fix or a Band-Aid solution to many disturbances, specifically for chronic women's health conditions. Whereas I think we need to look back and kind of reinvent the future almost for what's called medicine 3.0. And that looks at each individual as a whole and says, all right, you have these conditions. You may need medication therapy to help manage or stabilize these acute chronic hormonal conditions. But what are your individual risk factors? What are your individual circumstances? And where can we kind of peel back the layers of the onion and break them apart and address it from a different perspective to get you to really win the long game, which is decreasing our overall risk for heart disease, diabetes, strokes, Alzheimer's, dementia, all different other chronic diseases that are going to affect us as we age. So I like to use that reference in terms of how traditional medicine and lifestyle medicine really can intersect with each other, but really complement with each other.
So elegant. Thank you for that. I love this medicine 2.0 and 3.0. I know we get really kind of hung up sometimes with patients who are really have gotten really tired of the traditional medical system, and they come and they say, well, traditional medicine isn't doing it for me, and what are you guys doing? And it's like, well, we do practice from a standpoint of traditional medicine. So it's really lovely to hear how the basis of this is evidence-based. It is, we're practicing science. So this is medicine. And then we also take it this next step further into the world of 3.0. I guess in this new century or decade, we're into 3.0. No more 2.0. Very cute. Okay. So we're going to now get to some good stuff here about some tangible examples of how to practice lifestyle medicine. I will let Dr. P, if you want to get started on telling us just some examples. I think we'll take this one kind of more specifically towards PCOS. How would somebody kind of walk us through some of the factors for practicing lifestyle medicine for PCOS?
Sure. So one of the most common complaints that I get for a patient, let's say, who's already come to me with the diagnosis of PCOS, and they are looking for alternative answers or alternative solutions to help manage their symptoms. And the most typical symptoms related to polycystic ovarian syndrome or PCOS is typically weight gain and the uncomfortable acne and the hair growth and unwanted places are like the top three complaints that most patients are concerned with. And from that, the biggest complaint that patients will say to me is that I'm tired of seeing my gynecologist and they just gave me a prescription for birth control, or they gave me a prescription to help, fix my acne. And I want to do something more. I want to do something different. And so this is where I really like to highlight how both types of medicine really need to work with each other. So there's a reason as a gynecologist why we prescribe birth control pills. So birth control pills, it takes the work off of our ovaries. They don't allow for the hormonal fluctuations that tend to happen for PCOS. And so it also will increase another hormone called a sex binding globulin hormone that will chew up some extra testosterone that's floating around in patients who suffer from PCOS, which is really important for managing some of the acne and the hair growth or hair loss symptoms that people are experiencing. So there is a reason for why we prescribe the birth control pills. But I like to take it one step further, in addition to just prescribing the birth control pill or a medication to control the acne. So, I talk about like, all right, so let's, sometimes we have labs that support evidence that you have extra testosterone in this clinical picture. And we say, like, let's look at all the different places that could potentially be increasing your testosterone levels and what happens if we are walking around with extra testosterone levels, despite being on a birth control pill or not. And we know that patients who suffer from insulin resistance and testosterone go hand in hand. So for example, if we have these higher levels of testosterone, it inherently can lead to higher levels of insulin where our body just does not know how to convert the glucose that it's getting from its dietary sources, and it ends up turning it into fat, and it distributes in areas that are not good for you in terms of our long-term health for cardiovascular disease and diabetes. So if we think of that basic underlying mechanism, like where could we cut or make a break in the cycle to decrease our insulin resistance, then that can also help piggyback how we're helping treating the PCOS in terms of using a birth control pill. So this is where exercise can definitely help improve your insulin resistance. And we go into very specific, detailed, like actionable plans as to what a patient can accomplish and what is realistic. And then I also explain how sleep plays a major role in all of this, how sleep can help decrease our insulin resistance. So that's just a small example without literally stepping in. The best way to describe it is I walk in my patient's shoes. I ask them like what their day looks like and what's reasonable for them to accomplish. And then from there, we come up with a plan essentially that is combining medicine. And I explain the reasons as to why we're using these medicines, as well as here's a prescription for lifestyle tools and techniques. And if you treat the lifestyle management as a prescription and really hold it to that same level of importance, that's how we can actually make some changes.
I love that. It's that again, what just a fantastically elegant way of saying we treat this as a prescription and it is part of your overall plan. And we definitely stress that a lot. That this is multifaceted layers of treatment here. Okay, Dr. Hardacre, back to you. Why don't you, if you'd like to, give us a couple of sort of examples again, kind of walk us through how we would use lifestyle medicine for somebody for like the normal aging process or kind of as they're going through maybe a perimenopausal transition.
Sure. I mean, first of all, this is like one of my, outside of PCOS, perimenopause is like the other like kind of hormone disturbance that I love to work with women with. I'm 53, so I'm like kind of experiencing it all myself, like at the same time. So I feel like I can really relate to them. But I think first of all, with perimenopause, it's recognizing that it is a normal life transition that we're all going to go through. And many women start this process in their 40s. And it's the years leading up to actual menopause, which is when menstrual function has ceased for a year. So it's, it can last several years, and it really leaves patients feeling unwell and feeling like just kind of things are really off for them. It's changes in their menstrual cycles, changes in their moods, changes in their weight. And so really kind of recognizing, okay, each woman's going to experience this in their own way, but having that conversation with them to really hear what is bothering them. They might not be bothered by hot flashes, but might be bothered by weight gain, or they might, or sleep might be their main concern. But listening to that and recognizing that with perimenopause, that this is another place where medical management and lifestyle management can really like both be used beautifully together. And so it's, you don't have to pick one route or the other. You can do both. And in fact, I'd encourage people to explore both and see if both are right for them, and have that conversation with their provider. But to talk about a few specifics, first of all, I'm going to just kind of run through a few things that are specific to perimenopause, and then just discuss a little bit about a case where lifestyle medicine was used very successfully. But with perimenopause, many women experience weight gain due to declining estrogen levels, loss of lean muscle mass, which is related to low estrogen. Also, many women find themselves leading more sedentary lives at this point in time, so that can lead to weight changes as well. Along with this, as Dr. P was describing with PCOS, we start seeing more insulin resistance. So, that's important to recognize too. So with these things, like really kind of getting into the nutrition, getting into their physical activity and what it looks like and what they're challenged by. Maybe they've had injuries that are chronic that have led them to be more sedentary. And then, looking at, okay, well, what can they do? So maybe they can't run that like they used to, but maybe they can, maybe they can walk, or maybe there's a pool nearby, but helping them kind of strategize around those, whatever their challenges are with the nutrition, the physical activity, the mood changes that can go along with perimenopause. The specific example I wanted to give, just because I think it was just like, this one woman has kind of stuck in my mind, is just like the power of having this conversation. But I saw her several years ago, and she came in and she was late 40s, and she had two main concerns: weight gain, which had been about 20 pounds over the past couple of years, which is very, not uncommon for women to describe this, and then excessive fatigue. So she was just exhausted and had gained weight and just really did not feel herself. And so we really just dove into all of those lifestyle factors and like what was going on with her, and ultimately discovered that her sleep had been really like affected by this perimenopausal timeframe. And so she really was not sleeping well. Well, when we dug in even more to the sleep conversation, so we really got into the nitty gritty, and she's like, well, I go to bed, but then my husband goes to bed much, much later, and then the TV's on, and I can hear the TV in the other room, and I just toss and turn, for hours. And anyway, ultimately, the goal we set was that she was going to talk to her husband about getting Bluetooth headphones. Okay. This one thing changed her life. because all of a sudden she was sleeping better. She started going to CrossFit at 5:30 in the morning. She said, she like, it really like to serve to this, like, to really take her out of this funk that she was in. Just there was a combination of lifestyle factors and that perimenopause timeframe. Because she had become more sedentary and like in her late 40s, and the weight gain had really, created some concerns for her. And when we finally got her sleeping well, then that's what it took to then create better exercise habits. And then all of a sudden she was eating better, and, it just kind of snowballed from there. So, I just think, recognizing, that wasn't rocket science, but yet recognizing the power of just really having that kind of in-depth conversation with somebody about what's going on in their home life.
Yeah, you really just, I think, kind of drove it home at the end there, that as you are working with your patients, asking the right questions and knowing how to get to the root of their predicament. And it's many people are really not used to this kind of care.
Well, I wanted to add something in, if that's okay. So I sometimes joke around with my patients that lifestyle medicine is like common sense medicine, and there's nothing new. We know all of these pillars, and we know all of these things that we should be doing, but where we really shine is help, like just like Dr. Hardacre said, like this patient knew she needed better sleep, but she didn't know how to get there. And I know that sounds very simple, but sometimes, when you're in the thick of the experience that you're having with whatever chronic hormonal condition is going on, it's really hard to see a solution. And that's where we come in, where we are giving actionable tools and plans. Sometimes they're really small, like just putting on the Bluetooth headset, or Bluetooth headphones or whatever. But sometimes they're very big changes that can really move the needle in one direction or another. But at the ultimate, like, end of the day, it gives our patients the confidence to see that they can actually make a change and it makes a difference. And if we keep providing that foundation to give people confidence to make the change, to make a lasting, impactful, meaningful difference in their health outcomes, then we're all going to be living to 100 super healthy and not having diabetes or heart disease or all the other things that go along with it. So that's the ultimate goal.
Yeah. Okay. I want to highlight something you brought out here, which is that in the thick of really not feeling great, if it's in the thick of the chronic condition or unexplained symptoms that we see so many people kind of come to us with, that we see lots of people, and I'm sure many of you even felt this at one point or another, that you know what to do, exactly how to take care of yourself, all the things, you've listened to the podcast, you've read everything, and I think that's we might be able to just help like uncover these small changes, because if everything was going great, you wouldn't need us. So that is such a beautiful point to make, that there is always something to kind of dig into, and it could be something really simple and it could become a really powerful change. So yeah, definitely encourage folks who are maybe feeling skeptical of like, but I already know all of this, that it can be really helpful to have somebody kind of mirror it back to you. Yeah. Okay. I love that so much. This is actually a really great kind of transition into the next topic that we wanted to touch on here, which is people who are maybe not diagnosed with a chronic condition. And again, we see this a lot at Allara, is that you are maybe don't have yet a diagnosis, or you've tried to get a diagnosis and doctors are maybe not giving you the testing that you want, or they are giving you the testing and everything is looking great in your lab work. So we do have lots of patients. We treat patients here, as I think you're kind of getting a sense that there are lots of other ways to go about this besides just like the magic pill. So let's talk a little bit about the patients who are not diagnosed with a chronic condition. and when we really can't pinpoint anything as a disease. Dr. P, I'm going to let you start with that one.
So this is actually pretty common. So we have so many patients where, literally they will come to us for an initial evaluation, and our initial diagnostic evaluation literally doesn't show anything out of the ordinary. The testing of the hormone levels that we are looking for, or the metabolic profile that we're looking at, it's like smack dab in the middle and everything looks normal. Yet the patient is like, no, but you don't understand. Like, I do not feel well. I'm gaining weight. I'm, all these, like a laundry list of symptoms. So that's when I get to take a step back and kind of put my lifestyle medicine hat on, so to speak, and just say, okay, you know what? I think the first step is just validating our patients' experiences, like understanding, yes, your blood work today at that window in time, that moment in time, did not show an abnormality. But I'm pretty sure if I checked your labs every single day, every single minute for the next, 6 months, I'd probably find something, but that's unrealistic. So that being said, why are we so hyper focused on trying to find a reason for the symptoms that we're experiencing? It's almost like changing our mindset and changing the script that we have generated, that there has to be a cause that we are hiding behind, or that we are wanting to be sheltered behind for the reasons for the symptoms that we're experiencing, as opposed to looking at it from a different perspective of like, okay, I feel horrible. All of these symptoms, these changes are happening. There isn't necessarily a identifiable disease or condition that that I can attach to, but I know that if I keep barreling down in this health trajectory, I'm going to become more unhealthy with so many other chronic lifelong conditions that, yes, I'm a gynecologist. Yes, I primarily deal with hormonal disturbances, but all of these chronic hormonal conditions ultimately lead to the main diseases that ultimately capture our attention as we age, which is the heart disease, the diabetes, the neurodegenerative or dementia type diseases. So if we can't find a reason right now as to why those symptoms are occurring, what if we just changed our focus and tried to start working on ways to prevent those main end of later in life conditions potentially from occurring? And that's where we can start working on just employing strategies and all different techniques, from stress management to exercise and nutrition, and just even having conversations that people don't like to talk about because we've normalized the way we consume alcohol and other substances, and just they all play a role. They all play a factor into how our health is kind of moving full speed ahead. So that's how I like to reframe the conversation.
Dr. Hardacre, want to talk a little bit about this kind of place of prevention that Dr. Pimputkar just laid out for us.
She just did a beautiful job. I actually approach it very much the same way. I really like for my patients to understand that, like, when their labs are normal, it does not discount how they feel. So you can still really not feel good, not feel your best, and have normal hormone levels. And sometimes it's just the way your body's responding to your normal hormonal fluctuations. And so then it's a matter of figuring out ways to manage that. I also think it's important to understand that, like, some diagnoses are made by a physical exam and symptoms, and some diagnoses are made by the results on laboratory studies. And so there can be things that we diagnose that actually don't have a lot to do with the labs. And so recognizing that it's complex in an appointment. It's not cut and dry. It's not cookie cutter. It's really, talking to the patient and really getting a feel for how they feel. And I love this particular question. And I love for them, particularly those people that, like, are really feeling bad, and we're trying to figure out what it is. But just asking them like to think back to the last time in their life that they really felt well, and having them really think about what was going on at that point in their life. Like, were they, were they training for a half marathon, and, whatever it was, like, just thinking about like what their social relationships were like, what their exercise routine was like, what all of those lifestyle factors, but thinking back to like, okay, a time when when everything was feeling really good, what did that look like for them? So.
Great.
And to add to that also, it's kind of like putting yourself in this place of vulnerability if you don't have a concrete, cut and dry answer on a laboratory value, that you can trust the process, that working toward improving your health goals, using lifestyle medicine principles, like that you're just trusting the process, that eventually you can feel better without necessarily knowing what the reason is to begin with. And that's okay. And then once people start kind of, believing what we're talking about and saying, all right, I'm going to believe you, I'm going to let you down, let you lead me down this path without really knowing why my weight gain is spiraling out of control, or whatever the symptoms may be. And when we start seeing that change that happens, it is so amazing to see the confidence that comes from this with our patients, as well as they feel empowered. Like they learned that they could actually attack a problem that they thought was insurmountable with just the power of themselves. So it's very empowering for patients to be able to kind of trust the process and kind of go down this pathway.
I love that. Trust the process. And it's why we take patients for, more than just one or two visits. And we built out a plan so that we know that it's a process. And thank you for just sharing what your kind of like what your framework is for how we get patients to where they want to be. And that is going to lead us to our final kind of topic of this webinar, and then we'll get into some questions. But our final topic is going to be, how do we prioritize this and make these changes into long-term habits? Yeah, so let's kind of start with like, what's the first step here? How do we make this into long-term habits?
You know what? I actually think it is the more simple we can make it, I think that actually is the easiest place to start. So I always ask my patients, like, where they are in their lives, what does their day-to-day look like? I really get down to routines and schedules and, family responsibilities and work responsibilities and all the different things that make a patient feel like there is a constraint, for example, on their time when it comes to like exercise, if we're going to use that as the example. And I tell a patient, like, okay, so these are the outside circumstances that we cannot control. What are the circumstances that you potentially can control? And then from there, we build. And I sometimes literally will make prescriptions for different types of exercise plans. And I will have patients, literally write it in or put it in on their Google Calendar that they have to do increments of 15 minutes of movements at different points during the day. It's great for our, cognitive thinking. It's great for obviously so much of our productivity when it comes to our workday. If we're doing things like that, incorporating those types of intentional movement pieces. But I make those plans like non-negotiable, almost like, for example, if you had an ear infection and I gave you a prescription for antibiotics, you would complete those antibiotics because you want to feel better. And so it's the same concept. If you need to utilize exercise in your day to improve your long-term health goals, then you treat it like a prescription. And we come up with what is reasonable, what's sustainable. And it's interesting too, when I talk to patients, sometimes like these goals that come out are very like, I want to work out, an hour a day, 7 days a week. And we're like, okay, like, that's great. I want to do that too, but let's talk about what really happens in real life. Like where do you think the breakdown may happen? So we troubleshoot ahead of time. So it's almost like planning ahead of time for obstacles that can occur. And then where we meet in the middle ends up being actually very reasonable. And I would say almost 90% of the time, patients come back and they're like, that was so much easier than I thought that was going to be. So I always encourage people to just really sit down and just like we brush our teeth every day, you should incorporate some of these lifestyle changes every day.
Dr. Hardacre, anything you'd like to add about, maybe setting some goals and how we help to kind of get these practices into long-term habits?
Well, I just want to piggyback on to Dr. P with her comment about that, because I think sometimes we don't understand, not just other people. I do the same thing, but sometimes the power is in the actual action that we're trying to do. But sometimes the power is in just holding that commitment to ourselves. And so, like, for example, one time I had a patient, she was like, kind of felt defeated because she had set a goal of just getting on her elliptical for like 10 minutes a day. But then when we talked about it, she's like, well, she goes, but what's 10 minutes going to do? Like 10 minutes isn't going to really do anything. So she felt very defeated. So just didn't do it at all. But pointing out to her, but it's honoring the commitment that you have to yourself for those 10 minutes a day. And when you learn how to honor, how to make yourself a priority, set that commitment, like make it happen no matter what, even when it's 10 minutes, then all of a sudden you start gaining confidence in that, oh, when I say I'm going to do something for me, I do it. Because if we think that, okay, I could set these goals, but I'm not going to do it, if that's what our thought is, then we're not going to do it. But if we have learned, even through small steps and small goals, that we can honor that commitment that we make to ourselves, then that can then grow and expand and really become something beautiful.
Wonderful.
That's all.
No, that's so nice. It's so moving. And yeah, again, like when people are like kind of really struggling, it can feel like the mental health piece is really hard to overcome, but it's like a chicken and the egg. It's in a way that we do things to help build the confidence, build our self-esteem, and then sometimes the anxiety and the stuckness and the depression that a lot of people feel as a symptom of their condition, all
Well,
kind of.
and I'm going to show my age with this comment, but that's okay. But if you go back to like Mr. Miyagi in Karate Kid, and he had him just practice the little like menial skills over and over and over and over again. And like, that's what built his confidence and built his skills. And so recognizing like just doing those little things and being really committed to them can be a really powerful thing. And it never, like when you think back on it, you're like, oh, well, I didn't really even do that much, but it all adds up.
Yeah. All right. Okay. Thank you both so much for your insights here. We do have some questions to get to. And thank you again for everybody who did submit questions ahead of time. We used many of your questions to kind of frame the discussion that we put together, but let's get to some questions that were sent in. I'm going to jump down to this question here. What are the most important lifestyle changes for a person that has metabolic syndrome could make? Dr. Hardacre, I'll let you do that one.
Yeah. First of all, I'll make a little comment on what metabolic syndrome is. Is that fair?
Yep.
So it is kind of a constellation of signs or symptoms that we know are related to an increased risk of insulin resistance, prediabetes, diabetes, cardiovascular disease. Okay. There's 5 criteria, and it's meeting 3 out of the 5 for a diagnosis of metabolic syndrome. So a increased abdominal circumference is one. Hypertension diagnosis is one. A high fasting blood sugar is one. High triglycerides is one. And what am I missing?
Low HDLs.
There we go. So these are, yes, low HDL. I was like, earlier, I was like, oh, I should say what it is. And I was like, I hope I come up with all 5 of them. But anyway, so meeting 3 out of those 5. So as far as the most important lifestyle changes to make with that, a couple of comments. First of all, lifestyle medicine is a beautiful place to, metabolic syndrome is a beautiful place to use lifestyle medicine, basically is what I was trying to say. And I see it work like every day, without medications, without anything, without needing any kind of intervention more than just a change in lifestyle. As far as what that change in lifestyle should look like, I might ask Dr. P if she has an opinion too. I say start with absolutely whatever you feel ready to start with. So when 100%. You think of the nutrition, the physical activity, the, managing stress, improving your sleep, I think it's important to think about those things and think about what change or what aspect of my lifestyle do I feel ready to make a change in? Because ultimately it's all very interlinked, and all if you start sleeping better, guess what? You're going to start eating better. You're going to start moving better. You're going to feel more social. You're going to all of these things happen when you're sleeping better. Your stress is going to be managed better. And it works that way with each of them. So I would say whatever you feel ready to start with is the best place to start.
100%. And there's no wrong way or right way to approach something like metabolic syndrome, whatever is feasible and actionable for you. I mean, if we throw too many things on our plate, we become overwhelmed, and it's just way easier to walk away from any sort of, solution, right? So by addressing one thing, I think that's the best place to start. But really, holding yourself accountable, using somebody to help you hold yourself accountable also with that, I think is a big part of it. And there is so much evidence, there's so much literature out there that supports that a lot of metabolic syndrome can be almost entirely addressed by just lifestyle changes and not necessarily medications. And that, to me, I think is really powerful, that this stuff, this common sense medicine works.
Right. And I have seen it work even when just one aspect of it is addressed, somebody just simply exercising more, not being ready to make significant changes in their diet, but just saying, okay, I'm going to really embrace moving my body more. And that can simply be enough to make these changes.
Yeah. We did have a question here that I think goes kind of really piggybacks off of what you're saying here, which is there a place where in terms of kind of someone's mental health, is there a place where the kind of traditional medicine, if someone's taking medication, the question really was, is there a way around taking medication, and can we alleviate mental health symptoms just through lifestyle medicine, or does it go beyond that?
I think this is actually another great place where you can highlight where both, fields of medicine actually really complement each other. So we know, for example, that there's a high correlation. I'm just going to use the example of PCOS. There's a high correlation of patients who have PCOS that struggle with anxiety and depression. And we also know that as patients are experiencing the perimenopause, menopausal transition, we do see a heightened incidence of anxiety and depression at that time as well. So with that being said, if you are talking about managing some of the symptoms of PCOS or some of the symptoms, for example, like hot flashes and the vasomotor symptoms of menopause, there's definitely a place for medication management. And the same holds true for anxiety and depression. If you are truly suffering from anxiety and depression, then there is more than likely a neurotransmitter issue going on, and those need to be addressed. And there are medication options that will help improve the neurotransmitter state that your body is experiencing. However, the ultimate goal of adding lifestyle medicine to this is decreasing our dependence on the medications and increasing our reliance on using alternative strategies or alternative lifestyle principles to really help improve those stressors, those symptoms of anxiety and depression that are not completely being, controlled per se by the traditional medication. So they have done studies of patients who they've just looked at exercise, for example, for patients who were diagnosed with depression and anxiety. And they have found with kind of like with surveys and retrospective studies, they've found that patients who underwent like a coordinated, regulated exercise regimen, that they had similar improvements to their anxiety and depressive symptoms, similar to patients who were undergoing like cognitive behavioral therapy. Now, that being said, they also took that study one step further and they found that it didn't replace the need for medication. Like, so exercise doesn't completely remove or replace that need for medication. It just complements it. So I don't look at it like one or the other. I look at them as two options to really help patients like show up as their best self.
All right. Okay. Next question. We are running a little short on time, but we have like 2 questions to get through. And we're going to do a whole session on kind of perimenopause and the menopausal transition and in menopause. We'll do another webinar on that in a couple of weeks. But Dr. Pimputkar, I'd like you to just address a little bit about hormone replacement therapy and this topic and some of the key takeaways of this area. That was a question that was submitted, and this is a very hot topic right now. So I'd like for you to give us a little bit about that, about hormone replacement therapy.
Absolutely. So hormone replacement therapy it's definitely having a moment right now, which is exciting as a gynecologist that practices, because I think hormone replacement therapy has been stigmatized for various different reasons in the past, and I'm not going to get into the politics or the details of that. We'll do that at a later time. Mm-hmm. But whether or not to use hormone replacement therapy when you're in the perimenopause and menopause transition, I think that is hands down a very individual conversation between the patient and a provider who is knowledgeable, who is current, who understands the nuances of hormone replacement therapy and the existing conditions that each patient brings to the table. That being said, there's so many avenues to add in lifestyle medicine principles in addition. It's the same concept as of working with treatment for anxiety and depression. Like, this is a place, whether you start hormone replacement therapy or not, we can improve so much of our health, just based on making changes for sleep patterns and for exercise and for nutrition, stress management. All of these things play such a major role. For example, we use sleep, right? So if we're experiencing just debilitating hot flashes and night sweats and not able to get a good night's rest because of where we are in the menopausal transition, then it makes sense to really strongly consider if the patient is a good candidate in terms of the other parts of their health history, to start a medication that can help them improve that symptom. That being said, to bridge the gap and also take it one step further and really dive deep into like, okay, so how can we help improve your sleep? How can we minimize the distractions before you go to sleep? What are some rituals that we can start working on? What are some sleep practices? What is the improved sleep going to do for your overall metabolism? It's going to reset your hunger hormones. It's going to change your insulin resistance. It's going to make it so that feeling of the inevitable weight gain that happens during the menopausal time, it doesn't necessarily have to happen. Like, and there's so many different other strategies that we can employ when it comes to just one part, that's just sleep, you know? So that's where I think the conversation has to be super, super individualized when it comes to menopause, hormone replacement therapy, whether someone should take it or not, and then always adding in every opportunity possible where we can actually employ some strategies for their lifestyle and behavioral changes.
Great. All right, Dr. Hardacre, question for you. Is there blood work to determine whether someone is in menopause or going into menopause?
Okay, so the short answer is yes. There, like, you can do blood work, but you do not need, menopause is not a diagnosis made based on the blood work. So the diagnosis of menopause is made when, you know, a woman's gone more than 12 months without her menstrual cycle. And so, you know, just knowing that, okay, if you're in the, you know, 45 plus age range and you now go, you know, that period of time without a cycle, and it's associated typically with vasomotor symptoms like hot flashes, night sweats, these other symptoms, that's what makes the diagnosis. Now, there are findings on blood work that will correspond with that as well. So, you know, that is kind of the long and the short of it. Perimenopause can be a little trickier in that sometimes it's kind of happening at a time when other health issues can happen as well. And the symptoms can be kind of vague. Sometimes women are having menstrual disturbances and weight gain and those things that we talked about. And so it's a matter of, that's where the blood work becomes more important, is really understanding the woman's set of symptoms and using some blood work to make sure not like something else isn't going on. They don't have a thyroid issue or something else causing their periods to be irregular. But particularly like if they're in that 40 to 45 range, then it becomes a little safer to say that's what's going on if they're closer to 50.
Great. And yeah, we're definitely going to do a whole another session on this menopausal topic. So stay tuned for that. Okay, Dr. Hardacre, last question of the night, or last big question of the night. What are some things that one can do to incorporate in their day to decrease excess testosterone?
Oh, okay. Yeah, that's a good question. Kind of, Dr. P touched on it earlier. With her discussion about insulin resistance. So first of all, I think it's important to know why your testosterone is elevated. So recognizing that that is a discussion to have with your provider and making sure that that diagnosis is clear, or there's an understanding as to why. PCOS is the most common thing we deal with elevated testosterone, but there are other things out there. And with PCOS, then it really then comes down to improving insulin sensitivity. And when you start improving insulin sensitivity, then there's a downstream effect on the ovary and testosterone levels normalize. It's actually really, I mean, my patients might think I'm kind of nerdy with this, but I get really excited about it because it is a place where you see results with lifestyle. And it doesn't take very long. And so, you know, when they start really kind of working with a dietitian on those nutritional changes that improve insulin sensitivity, they start moving their body, even if it's not a lot, but like moving every day in some kind of intentional way that just feels good. You know, they work on their sleep, they try to manage their stress. All of those things play a little role in improving insulin sensitivity. But the downstream effect will be improved testosterone levels.
Right. All right. Anything to add, Dr. P, on that?
No, I mean, it's so true. Like you literally physically see major changes with just small incremental changes. And, and the best way to kind of also talk about in general, the concept of medical management with lifestyle medicine management is, it's these small little changes that we make and we course correct as we go along. And that's what builds upon the confidence to be able to tackle the next thing, for example. So, if the testosterone hormone level and the symptoms that come from those elevated levels really are the main bothersome thing that is affecting our patients, these small changes and you watch them make it, and they don't have to be perfect changes. Like that's the beauty of it. Like we adapt as you go along, right? Like, and we are here as like health coaches, as medical providers, as lifestyle medicine physicians. Like we kind of wear multiple hats to give patients all of these tools. And that's what I think is kind of the cool thing about this.
Mm-hmm.
And I tell my patients that I want them to do B+ work, because
Love it.
There is this feeling sometimes like that everything needs to be perfect, but sustainability is found in that A- B+ work. Like when you can allow yourself to not do it perfectly, but do it pretty good most of the time, that's when you're going to make changes and you're going to be able to keep doing it.
I love it. I bet a whole bunch of people just suddenly felt a lot better about themselves and their educational history. Okay. All right. We're going to wrap up with one final kind of fine point on all of this. What is if you could say one pillar or two pillars that are kind of like high priority, your favorite pillar for lifestyle medicine, tell us what are your favorite pillars, your favorite one or two pillars? Dr. Hardacre, go.
Okay, I'm going to give two. One has to be, in my mind, physical activity. I think it's my own mental health care. It does not have to be anything crazy. I just encourage people to move their body in some way they enjoy every day. So I think there's so much power in that in so many ways. And then the second one is sleep. I am like an expert sleeper, but not just for me, but for everybody. It really does make a huge role in your recovery, your repair, in your hormones, like everything. So many things are intertwined with your sleep habits. And so really kind of working on nailing down good sleep is important.
Okay. All right, Dr. Pimputkar, same question. What is your one or two highest priority pillars of lifestyle medicine?
So mine would have to be stress management and improving like true meaningful social connections, and they might even be kind of interrelated. There's, again, it kind of goes back to everybody really wants to find a reason for why they are experiencing some of the symptoms that they go through. And people will ask us on a regular basis to have their stress hormones evaluated. And it's not so much, in certain cases, those are very important, but it's more about like dampening the fluctuations of those stress hormones that actually make the major change as time goes on. The goal is to decrease those rises and falls, and then the cascade of other like whole body hormonal events that occur because of these rises in our stress hormones. So with that being said, like it's self-care. It's, really taking the time to prioritize yourself and managing or removing or changing your circumstances that are causing you to experience those stressors, if it's within your reach, to asking for help. And then that kind of also pulls into the other part of it, which is making meaningful connections. Like surround yourself around people that support you, that understand you, that validate what you're experiencing, and they're not just trying to fix it and then move on to the next thing. Like really somebody who is going to listen to what you are going through and try to make a change that you can, or help you make a change and make a difference in what you're experiencing.
So beautiful, very emotional. This really resonated with me a lot, this talk tonight. I hope that those of you who joined felt more hopeful, or got some ideas for some things that are achievable for you. And if you need help getting started with this, it is not, no one here is saying that this is easy to get started with, and that's why we are here for you. So please do, if you are not yet an Allara member, it's really easy to get set up and start your process of getting your labs checked, getting an assessment done by one of our amazing practitioners. If you're currently a patient, some things maybe to think about for your next session with your provider on, like, how can we start, helping to get these changes in place. So I really hope that, or even just feeling like you can do it. That's one of the most important things here at Allara, is this kind of community that we bring together that is always here to support you. I do lots of patient outreach, so if you need me for anything, please don't hesitate to email me. And I really hope that this was a good experience for you all. Thank you so much, Dr. Hardacre and Dr. Pimputkar, for your just wonderfully insightful and meaningful and hopeful words this evening. We will end this now, and everybody will get a recording. But thank you again. Have a good evening. Bye.
Thank you.